We're going to continue with our special program. We have a really special keynote speaker coming up next. She's actually the highest-ranking Latina at the Oval Office at the White House, an advisor to President Biden and Vice President Harris. But before I introduce her, just wanted to, again, thank you all for being here. We've appreciated your participation, your engagement. The next panel after our keynote speaker is also on reproductive rights and freedoms, particularly thinking about the Latino community. So very excited and looking forward to that conversation as well. We'll have that conversation, and then some closing remarks. And then, as Secretary Becerra said, hopefully we can get wrap things up, and then off to the pachangas, wherever those are at. But next, we have, as I mentioned, Assistant to the President. She's at the White House currently, Director of Political Strategy and Outreach, highest-ranking Latina to the President and the Vice President. Emmy Rees serves as Assistant to the President at the White House and is Director of Political Strategy and Outreach. She is a former campaign aide to Vice President Kamala Harris, former Secretary Hillary Clinton, President Barack Obama, Democratic Chairman Tom Perez, and several other leaders. She and I have been in several foxholes together. She leads a lot of the outreach for the White House currently. During the 2018 and 2020 cycles, she helped support mobilization across the country. She is one of the unique White House senior staffers that is able to both do political work as well as official work. So in the nonprofit sector, she's able to do both C4 and C3 work at the White House, which is a rare role for her to have. But she's certainly a very seasoned an expert operative in political campaigns, having worked the 2016 cycle, she was also on Annie's List in Texas. In 2012, she served as a general election director in Nevada for President Obama, and as well as his re-election campaign. She started as an organizer in East Las Vegas, Nevada. Born in she's going to kill me that I'm butchering this, Harrington, Texas. Emmy is a graduate of the University of Texas at San Antonio and lives here in Washington, D.C. With her wife and 2 kids. So it is my pleasure to bring up our next guest speaker, Emmy Rees.
Hi, everyone. Good afternoon. It's so nice to be here with you. The most important thing that Eduardo said is that I'm actually from the Rio Grande Valley in Texas. I don't know if anybody here is from the 956, but there's actually a lot of us in the administration, and it's just a real point of pride for me. But as Eduardo said, my name is Emmy Ruiz, and I'm the White House political director. I'm an assistant to the president, and I'm very happy to be here with you and to have colleagues like Eduardo who have done critical work fighting for our communities. I saw that day in and day out when he was on the COVID task force at the White House, and how much he worked to think of innovative ways to make the vaccine available to our people, but also making sure that we were communicating in ways that made sense, that we were doing everything that we could to reach Latinos, not just where they're at, but everywhere they're at. So thank you to him, and thank you to so many of our colleagues that are here today. It's nice to be here today, not just because of our shared culture, our backgrounds, our shared identities, and the work that we're committed to, but I know that the work that you do day in and day out has made a real difference. We're really proud of everything that the president and the vice president have accomplished, but as they like to remind us, nobody gets through life alone. Right? And none of those things would have been possible without many of you in this room, your teams back home, your organizations, the entities that you represent, the people in your communities, in your family. Quite honestly, without you, probably there would never have even been a President Biden and a Vice President Kamala Harris. And so I want to thank you for your deep partnership. And of course, I want to thank Secretary Becerra and the Department of Health and Human Services for having me here today to be able to talk about the great work of the Biden-Harris administration and all that we have accomplished over the last 3.5 years. I'll start by telling you that we're not done. We have quite a bit of time left, and we're going to do everything we can to run through the tape. Just last Friday, the president convened the cabinet, and one of the directives that he gave everyone was, I want you to get me a memo of anything that you feel is a roadblock to the critical work that we're doing, anything that is a roadblock to making sure that we're getting the funds out to care for our communities in every single state. And so that will give you a little bit of insight as to how we're approaching our unfinished work. Today, the president continues to build upon, strengthen, and protect Medicare and Medicaid and the Affordable Care Act, signing laws into place such as the American Rescue Plan and the Inflatable Reduction Act that have lowered prescription drug costs and health insurance premiums. Thanks to the president's effort, more Americans have health insurance today than under any other president in history. That is a difference maker. One of the things that the president often says when we're talking about reducing healthcare costs or we're talking about access to health insurance is that for many of us that are parents in the room, it is about being able to provide your family with dignity. It is about being able to go in and day out, not being afraid of what might happen, but making sure that you are covered and that you have everything you need to flourish, to prosper, and to be successful. Another upside to the work that we're doing is that the Affordable Care Act is more popular than ever, more affordable than ever, and it's easier to sign up for millions of Americans in underserved communities. In total, 45 million Americans have coverage thanks to the Affordable Care Act, and millions more benefit from its critical protections, like not being denied coverage due to pre-existing conditions or being charged more for simply being a woman. Many of you all will remember that this is a very big piece of President Biden and President Obama's legacy. As he famously said, this was a BFD, and as many of you know, the fight to protect the Affordable Care Act is far from over. I mean, we see it day in, day out in the news in what, some of our opponents are trying to do is overturn either the Affordable Care Act or critical components of that, including the pre-existing conditions clause. And we cannot allow that to happen. As it pertains to the Latino community, enrollment in the Affordable Care Act has doubled since the president and vice president took office, from 1.7 million people enrolled to 3.4 million Latinos enrolled. And over the last decade, 15.5 million Hispanic Americans have joined coverage overall. President Biden's efforts to ensure coverage for Latino Americans doesn't stop there. Starting on November 1st of this year, thanks to the work of everyone here at HHS and the Biden-Harris administration, DACA recipients will, for the first time ever, qualify for financial help to buy their own health insurance in the ACA marketplace. That is another big deal. And that's just around the corner. These accomplishments go far beyond the numbers. Last year, the president traveled to the Lehigh Valley. Many of you all know is home to the burgeoning Puerto Rican community in Pennsylvania. There, he met with Juan and Lauren Vargas, a married couple of owners of Nowhere Coffee. So he was doing a tour along the main street in Allentown. There, he sat down with them to talk about small business, to talk about what it means to open a small business, to keep a small business, and how that is a real sign of hope. They shared with him that day in and day out, their customers come in and they share their greatest pride points, but they also share some of their biggest worries, including the need for health insurance, the need for lowering costs, the need for mental health services. And the president, Juan, expressed that if the drug prices were lower, many people in his community would be able to contribute, to purchase, make purchases at small businesses like him. I think this pointed to just how connected everything is. The ability to have health insurance, the ability to stay healthy, the ability to contribute to the economy. In August of this year, President Biden announced new negotiated prices for the first 10 prescription drugs selected for Medicare price negotiation. About 9 million people with Medicare use at least one of the 10 drugs selected for negotiations for conditions including cancer, diabetes, blood clots, and more. When they go into effect, these new prices will lower Medicare spending by $6 billion and save people on Medicare $1.5 billion in their personal out-of-pocket costs. And it's not just about Medicare. It's not just about what we're doing with the Affordable Care Act, with the marketplace. A lot of this is, what the work that's been done at HHS, but also at the White House, goes far beyond in what is impacting our communities. I think a great example of that is a bipartisan Safer Communities Act, which is one of the first pieces of legislation passed in more than 30 years dealing with the gun violence epidemic. And that has been a really big deal in making sure that gun violence is decreasing in this country. This resulted in the most significant gun safety law in more than 30 years. And just this past year, the president launched the White House Office of Gun Violence Prevention. And so now every time there is a shooting, there's a deadly shooting, the White House, along with resources provided from HHS and other agencies, are able to go into the communities and provide so much of this critical relief. This is important not just because we know this is impacting our communities, but we also know that this is an issue that is incredibly important to Latinos. Research after research after research shows that this is gun safety is an increasing worry for our communities, for our kids in schools, and that's why it's important that we're responsive to that. That and many other pieces, we know we have so much work left to do. We're going to continue to focus on that. We're going to make sure that we continue to hold Big Pharma accountable, that we hold some of our opponents that are trying to slow progress accountable, and that we continue to work with each and every single one of you, your organizations, your entities, with our incredible secretary here with Secretary Becerra to continue to make progress. As political director of the White House, I'm committing to making sure that the president's record of accomplishment for the Latino community is echoed across the country. That includes working with the President, First Lady, Vice President, and Second Gentleman to coordinate events and travel across the country that highlight our Latino communities. But the truth of the matter is we need your help. We need to make sure that people know of all of our incredible accomplishments. Yes, it's important for people to know everything that we have accomplished politically, but you all know, and I know this, that we still have a lot of work to do to make sure that our communities know the benefits that are available to them, the resources that are available to them, that help that is available to them, and for them to know that for every problem that they have, there is a team that includes you, that includes HHS, that includes the White House, working to address that issue. And so with that, I will conclude the way I started, with a tremendous thank you to you for all of the work that you do day in and day out. We would not be here if not for your partnership. And I know, as somebody who has benefited greatly, grown up in a community that has benefited greatly by your work, the work that you're doing is making a tremendous difference. And so again, thank you for having me. And we have to continue running through the tape and making sure that the next few months of the Biden-Harris administration count for everything we can. Thank you.
All right, thank you so much, Emmy. How about a round of applause for the highest ranking Latina in the White House West Wing? All right, and next we have another great panel of more Latinas, phenomenal Latinas, and so it is my pleasure to bring up the next panel, which is on protecting Latinas' access to reproductive freedom. To introduce the panel, which are representatives from leadership in California, Planned Parenthood, and other groups, I'm going to bring up my colleague, Melanie Fontes-Renier, the Director of the Office of Civil Rights here at the Department of Health and Human Services. Melanie?
Thank you so much. So we're really excited to have this panel. Sorry, I'm just looking for their names. I do know their names, but I don't want to get them wrong. You can appreciate that. Sorry, I actually just got off a plane from Nashville. I was at AHIP this morning, which I just literally took a cab here and got off, so pardon this second. You're allowed to laugh or like have empathy for that. So thank you. So first we want to welcome Karen Gomez, the Bilingual Program Manager of Education at Planned Parenthood of Metropolitan Washington, D.C. Next, we want to welcome Cincy Hernandez Cancillo, Vice President of Health Justice at the National Partnership for Women and Families. And certainly not last but not least, Dr. Diana Ramos, California Surgeon General at the Office of the California Surgeon General. So I wanted to take a minute just to talk about some of the work that the Biden-Harris administration has done. Before we start the panel, many of you know that this has been a really groundbreaking time for reproductive health, in particular in the federal government. As someone that's worked a long time for reproductive justice, having a president and a vice president not only say the word abortion, visit abortion clinics, and sign not one, but two, but three, but four executive orders on women's health, we are at a sort of break glass time for this care. And through that work, both this building and across the U.S. government, the Biden-Harris administration has done a lot of work to protect access, to support access, and to do as much as we can to fill the void left by the falling of Roe v. Wade. We all know that we can't fix what happened with the loss of Roe v. Wade. We all know, as Cincy, I'm sure, will tell us, there's a disproportionate impact on Latinas. Nearly 6.7 million Latinas live in states that have banned or nearly banned reproductive health care. The Biden-Harris administration from day one took very proactive work in this space. I personally have been to at least 14 states that have banned abortion care, having conversations with doctors and patients and providers and promotoras and advocates and patients, making sure we're talking to community about what the law is and is not in a post-Roe reality, talking to people about their patient privacy, and making sure that we're having an openness and bringing people's rights to them instead of waiting for them to be brought here to Washington, D.C. As part of that work, just some of the highlights. So the Biden-Harris administration, through my office, issued a reproductive privacy rule to support healthcare privacy for reproductive care, which shields your medical records when you seek, obtain, provide, or facilitate lawful reproductive health care. That rule went into effect this summer, and so we're really proud of that and think that will help especially women that have to travel for care when they go somewhere and they come back, that them and their home provider will be protected from unlawful intrusions into that medical records and protect that provider-patient trust. We've also worked to make sure through Section 1557 of the Affordable Care Act that we're making sure non-discrimination in healthcare includes both pregnancy and pregnancy-related conditions, which is so important right now. We've all read about the horrible stories across the country of women having to go back to their cars to wait, to bleed more, women who are dying because they cannot get reproductive health care. And so we're doing as much as we can on this space. We know that we had a case go up to the U.S. Supreme Court earlier this year on emergency medical care under EMTALA. No one should be worried that they won't get treated if they have to ever end up at an emergency department and told they're not sick enough to receive that care. That's why this administration has been clear. All patients, including those experiencing emergencies during pregnancy, should have access to stabilizing emergency care, which can include abortion. Free birth control, we know that the Centers for Medicare and Medicaid Services and as well as the Affordable Care Act have taken monstrous steps to ensure women across the country continue to have access to free birth control, including 58 million women nationwide. And we're also fighting to ensure attacks against treatment like IVF, which we know is happening across this country. So I will go ahead and take this opportunity, there's a microphone there, take this opportunity to start our panel. Is it just, it's just on? So why don't we go ahead and start with each of the panelists just telling us a little bit about why you're here and your role in this fight. We'll start with you, Dr. Ramos.
Thank you very much, and thank you for being here after the long travel. As was mentioned, I'm Dr. Diana Ramos, and I'm the California Surgeon General. I'm also an obstetrician gynecologist. And so women's health, reproductive health is something that I have been doing my entire career. But I've also been doing it with a lens of public health and the prevention and how really incorporating the whole scope of healthcare really makes a difference in women's health. And now with reproductive health, abortion care is essential health care. And it's all in the framing and the explanation, and I am just so pleased and honored to be part of the esteemed panel. Thank you for having me.
Hola, buenas tardes y buen provecho. My name is Cincinnati Descancio. I'm really glad to be here, glad that you made it. And I'm very glad that you are all here. I work for the National Partnership for Women and Families, and our health justice work, which is what I lead, consists of three very interrelated streams. We do maternal health, we do reproductive health and rights, and we do healthcare system transformation. And what we have seen, and we are very, very focused on how it is that we build a healthcare system that works for everyone, and especially works for women of color, because the healthcare system we have right now was not designed to really work for us. The three, is this a three major challenge? Is this a challenges question, or just say hello?
I threw in an extra, like a softie, to get to know you, but if we can go to the challenge, if you want to start the challenges, that's fine too.
No, I'll wait.
Okay. See, that's organic dialogue. Yes. Thanks, Josie.
See, you throw in an extra thing, and I'm just like lost. But yeah.
But you're a woman of color, so you just rolled with the punches.
We roll. We're all about the rolling. Dale.
Hi, thank you. Hi, all. My name is Karen Gomez. I am the bilingual program manager for Planned Parenthood of Metropolitan Washington, D.C., which is our local affiliate. I've been at Planned Parenthood for over 15 years now. I started as a peer educator because in our communities, I'm from Mexico, my family, we all migrated here. And I think our village was lost, and with that, like my mom's village of to raise children was lost, is what I meant. I think within that, sex education was lost. My mom tried so much to give me the sex education that I needed. But I found Planned Parenthood, and through their peer education, I kind of realized that our story was very similar to other stories of my peers. We live in Montgomery County, so it was very kind of like, okay, so it's not talked about, it's very taboo. And then I just got interested in sex education and became a sex educator myself. And then I started to do a lot of teaching with youth. And then I started to realize, well, who is teaching the parents, right? So we had peers that were like, okay, but I can't go to my mom or my dad and talk about condom usage because me van a regañar, right? They're gonna get upset at me. So then it became, okay, well, let's teach the adults. So then I became the program manager for bilingual work, which is adult education. And through that adult education, there's already peer leaders, which then became our promotoras. And our promotoras are essentially our heart work. They are the ones who are pushing forward a lot of the education. They are essential to healthy communities. And I think through my work, I realized the vital work that they do, because they are raising the next generation. They are that village for mothers or parents who have children, and being a parent is so hard, especially when the kids are little, and they became that voice. So I'm here to put that perspective of education, of storytelling, and how it all connects to then get folks the services that they need through our health center, and then also to maintain the laws, right, that protect them through our advocacy. So we have our three pillars: education, healthcare, and advocacy, which are all essential to a healthy, thriving community.
So Cincy hinted at the next question. So we know that there's been a lot of chaos and fear in the healthcare space across the country in a post-Dobbs reality. And so I like to caveat that with, for many of us that have worked in the space, Dobbs was the floor, right? And before Dobbs even existed, there were extreme restrictions, and a lot of women had to travel or go through extreme barriers to get care in the first instance. And so in this post-Dobbs reality, given the panel's expertise here, if we could just talk about what are some of the challenges you're seeing across the country and how do they apply to your work? So one challenge that I'll just briefly mention, and I hope comes up, is language access, right? So we know that, we've talked about 6.7 million Latinas, we know that language access continues to be a huge problem across the country, no matter where you are, if you're in California, if you're in Alabama, that there continues to be barriers to language. And even so, I'm from Maricopa County. My office did a civil rights investigation of the Maricopa County Superior Courts. They were not translating basic court documents into Spanish. And I flagged that not to trash my home community. I'm very proud Arizonan. But I flagged that to say a very large Spanish-speaking community was not translating documents for court, for justice, into Spanish. That's a problem. And I think if that is happening in places like Phoenix, that of course is happening across the country and in various languages. And so just one of the layers of that. So I'll turn it back to you, Cincy, maybe you can get us started.
Sure, and I guess since I didn't do the real introduction of myself, I do want to say that one of the reasons that this work is so important to me is because the connection between maternal health, reproductive health, how our systems aren't designed to help us, and I myself come with a story of barely making it out alive from birthing here in the nation's capital, where you'd think there'd be a lot of resources and hopefully better quality care. But going to the three challenges, the things that, the fact that we do this work in the three streams, one of the things that we've really struggled with is making sure that people understand, and especially policymakers understand, that is all connected, right? And that what it actually means to be in a country that is structured to kind of drive compulsory pregnancy for some of us, when maternal health and being pregnant and giving birth itself could be a life sentence, a death sentence, right? And then the domino effect that happens across, it's not just that abortion provider, you can't get an abortion in X or Y state, but then what does it mean, especially when we have huge maternal health deserts across the country, when abortion provider, when gynecologists and obstetricians leave because they cannot, in good conscience, without major, moral injury, continue to treat their patients the way they know and they feel, with their, with their expertise, need to be treated. So it's many layers, and it's a huge domino effect. One of the most egregious things I think that came out of Alito's decision was this concept that you could just, pull abortion out of the mix and everything else would stay the same. And that is just patently untrue, and does not understand the ramifications on women's health and what it means to try to be and stay healthy, and have the right to decide when and how and if to have children, and to actually be able to survive that process and be healthy. It means something very different when it comes to the on-the-ground daily experiences that we have to go through, especially if you're a woman of color in this country, and especially if you're a Latina. And we've seen the devastating impacts, right? As Melanie was saying, people having to wait in their cars, people having to be airlifted out of their state to another state, and some people have even died. And then what does that mean in a country where there's so many, many of us already coming into these spaces with histories of trauma, and then this is all like re-traumatizing, right? And for those of us that even work in it, it's somewhat re-traumatizing to be told that you cannot be the boss of your own body, and that you have to risk your life and your health to be able to, exist. And so for us, being able to pull all that together has been it's really, really important, because we are not just our uteri or our fallopian, I don't know if that's the actual plural of uteruses, I don't know, and fallopian tubes and ovaries.
Cacti.
Yeah, so, we are much more than that. We are whole people, and we are not being treated like whole people.
That's great. I mean, it's not great. That's terrible. That was a helpful response. Dr. Ramos?
Yeah, so I think with the realization once the DOM decision came through was the stark reality that we have a patchwork of laws that, depending upon what state you're in, everything's going to be different. In California, we have really been open into welcoming people who need the care. You mentioned people coming over from other states. We are one of those states that is welcoming people to come to California to receive the care that they need. But the reality is that we have to not only maintain access, but we also have to coordinate that access, whether it's regional and whether it is, is it at the border, is it in the very rural areas of the state? And the most important reality is that the demand is increased. It's increased not only by people in our state, but by people who are coming over from the other states. And we have a higher use by those who are undocumented, those who are Latinos, those who are already living in California. In California, Latinos make up 40% of the population, as it does in Texas. So that reality being that oftentimes it is a Latina person that is needing the services, so that coordination is oftentimes challenging. But California really is focusing on being and that leader in reproductive health and reproductive justice. So we continue to do the work and provide the services that are needed, but not only the Californians, but those who are needing it from other parts of the country as well.
For us, in the education aspect, we realized that a lot of the documents weren't properly translated. And I think when we're talking about abortion and then we translate it into Spanish, it really gets lost in translation, because oftentimes what I realize is that it can also mean a miscarriage, and having a miscarriage and having an abortion is completely different. So in the last year, I think that we really, all of us, my amazing team, gathered ourselves and we're like, okay, we need to talk about abortion and how can we do this. So the first thing we did, we made a half-sheet informational about abortion. Like, what is abortion? What is a medical abortion? And what is a pill abortion? So medication abortion. And we distributed it during our outreach events. We also gave it to our promotoras to then pass it on to folks that maybe they trusted them enough to talk about, hey, I need an abortion, where can I get help? So we were able to translate it, offer the information, and then add in a QR code so people can then access our webpage. And then in our webpage, we focused on translating it and making sure that the content that was there, if somebody was to navigate it, was in Spanish. The other thing, we have a health training institute, and through there, we're able to provide training for Spanish speakers. And I feel like when I first started this work, there wasn't a lot of Latinas, Latinos, Latina folks doing the sex education work in Spanish. It was very limited. So through our Health Training Institute, we were able to then offer that, and oftentimes organizations like La Clínica come to us to train their promotoras, their community health workers, and I think that's important because they are the ones facing the community. Another challenge that then we faced as we were getting closer to this year was that then folks wanted to talk, okay, so we're talking about abortion. What are the laws? A lot of folks didn't even know the laws. I was doing a session and somebody was like, wait, I can get an abortion here in Maryland? Because they thought that it became illegal throughout the whole nation. So then you imagine, like, we are very much a community and we learn by talking to like our comrades, right? So I imagine, and I'm like, if this is the conversation that is happening, I wonder what other conversations are happening and how can then tap into the communities that perhaps are not coming to our sessions, are not coming to our trainings. And we created a 3-video series in partnership with La Clínica. We were, through our national affiliate, we were granted some funds to then do a sub-grantee, which was, one of them was La Clínica, and they were able to do a focus group that talked about abortion. So how does the community feel about abortion? And one thing that came from that focus group was that if we connect human rights to abortion care, the community is more lenient to listen and to learn, because then they realize, oh, as a community, we all care for each other. As a community, we know our neighbors. As a community, we're very close to our family, and we want to make sure they're protected. So we want to protect their human rights, and that includes abortion and abortion care, right? And education around abortion. So to us, it made sense to then create a 3-part video series. So it is on our page, ppmw.org. We have the series there. It's on our YouTube, and it's created by our promotoras. It is in Spanish. They were able to really look at the language and make the edits necessary. So then, because they know the community best, right? So they were able to really put forward information about how when they come into our health centers, their medical, everything is going to keep private. A lot of the worry of them is immigration going to ever find out that I had an abortion? And that answer is, well, as of right now, no. Like, they're not going to seek that. So then it makes folks more comfortable. We also did a lot of myth busting around abortion. We talked about the medical abortion, and for a lot of our communities, they didn't even know that a pill existed. A lot of times they thought that the plan B was that, and I think we also see it in media. So we changed that narrative and said, okay, let's get on social media, let's educate, right? I think now a lot of communities are getting into WhatsApp groups and passing out information, passing out events, and I think that that's so important, because that's how we get the communities that usually we don't see, right? Like I mentioned some of those sessions.
Yeah, I mean, that's a really good point. I think both the immigration point, which, continues to come up. I know a lot of our work across the country, there was a lot of work done in the previous administration on things like public charge, right? Which we know have a detrimental effect on many of our communities across the country, where people who are entitled to federal benefits might be too scared to utilize them, people in mixed status households. We know that has an impact on our kids. We know that has an impact on our communities, and continues to have that impact, even though the rules have changed back, right? And we know that there are continued efforts across the country to try to scare people from seeking health care in certain places. Dr. Ramos, can you talk a little bit, just going into that sort of state vein, can you talk about some of the work California is doing, and maybe are there things other states should be doing?
Yeah, so California is committed to be a sanctuary for reproductive health, and as such has passed a lot of laws that, from Prop 1, which enshrined the right to have an abortion in the state constitution, to privacy laws, as well as, and I love the fact that you're highlighting the peer-to-peer funding for those who want to study, who want to do reproductive work, scholarships, grants. There's the abortion.ca.gov. I'll push our website, abortion.ca.gov, that gives not only policy information, but also highlights resources and where you can get care. You put in your zip code and you find out where you can get the resources. So really meeting people where they are. There's been privacy laws that have been passed that protect not only the patients, but the healthcare providers as well, and those coming across state lines to provide the resources that are needed. Some of the resources that are paid for, depending upon the person that is requesting it, could be transportation, could be childcare, could be lodging. And so California is truly committed to providing the services and the care that is needed in a culturally respectful way, taking into consideration the language, and knowing that just because you are Latino, Hispanic, you speak Spanish, you don't. We realize that in lots of parts in California, a lot of the population speaks Mixteco. And so how do we provide the care for those people that speak other dialogues? And we're creating solutions, we're creating frameworks that can be used by other states, because we know that when California leads, everyone follows.
I think I've heard that before. So just on that point, on the privacy law, just to put a point for the federal government, California's law protects you when you're in California, But when those women go home, they are not protected under that law, and that's why the federal government put up a new rule to protect those records. So obviously I worked on it, so I'm very proud of it, but I also want to make sure folks understand it's pretty consequential for those women and then their home providers, where we are seeing intrusion into those medical records. But thank you for that, Dr. Ramos. Ms. Hernandez-Cancio, can you talk a little bit about the work of the National Partnership for Families? You released research that puts a spotlight on state-level abortion bans, what that means for Latinas and other women of color. Could you talk about this work and the impact to working families across the country?
Sure, thank you so much. So we're very, very excited, and I need to do this shout out. We did this work and released it with the National Latina Institute for Reproductive Justice. I think some of you were here earlier, but yes, we love you. And what we found, and I think Melanie mentioned this before, is that nearly 6.7 million Latinas, or other words, 43% of all Latinas between 15 and 49 live in the 26 states that have banned or are likely to ban abortion. Nearly half of these women are actually mothers already, and more than 3 million of them are economically insecure. And we already know that low-income women are especially likely to have difficulty traveling across state lines to access abortion care, and they're overrepresented in low-wage jobs, like in the service industry, where they don't have paid time off. They have unpredictable scheduling, and so being able to travel can be nearly impossible. The other thing is that more than 1 million of the Latinas who live in these states do not speak English or do not speak it well. So the issue of language access is super, super important. And of those, 38% were born, I'm sorry, of the 6.7 million, 36% were born outside of the United States. So that gives us a kind of a view of some of the immigrant issues involved. And I just wanted to go back to the issue of, how do we protect privacy? How do we protect people who need to get these services and can't get them necessarily in their state? We have to think about over-surveillance. Focusing on the connections between reproductive health care access, pregnancy criminalization, and health and data privacy. Who is at risk? I mean, we all know who is at the most risk of being surveilled and criminalized, not just by, state prosecutors and the criminal legal system, but also immigration enforcement, as, has been referenced already. And so we also know that in those 26 states, anti-immigrant laws are much more prevalent, as are much worse maternal health outcomes. So it's a very, very challenging situation when you think about the risks that people have to go through when they cannot make the decisions on what they want to do with their bodies and for their families. Remember, almost half are already moms. And they have to overcome so many different barriers that put them at real risk of of criminalization, incarceration. Pregnancy Justice recently did a report, I think just a couple of days ago, that was looking at how much more pregnancy criminalization has jumped in the last year, and that unfortunately, at least half, more than half of the people who had to deal with being criminalized, the information that was gathered to do it came from healthcare settings. So that's why it's so important that this administration made the decision it did to try to protect privacy when it comes to reproductive health. But we also know that we are currently, those laws are being, those regulations are being challenged in court right now. Not only just repro privacy, but privacy in general. And so that's something else that our organization is, keeping a very close look at, because at the end of the day, we need to be able to make decisions that work for ourselves and for our families without intrusion, without being afraid that you'll be separated from your family or have to go through, even if at the end of the day you're found, not guilty, the process of having to go through something like that can be really make or break for any family.
How many people in the room knew, I know we get sued all the time, but how many people knew that there's a lawsuit in Texas right now that is suing not only a reproductive privacy rule, but our underlying rule from 21 years ago that would give you any privacy protections in healthcare under HIPAA? How many of you knew that? Yeah, see, honestly.
So look it up. It's really important.
So just flagging, right? Like that's pretty consequential. And again, I think the goal here is intrusion into healthcare. like things like even just getting your own medical records exist in that rule, right? Like, can I go get my medical records? That exists in that rule. That's not a statutory protection. It comes from that rule. Dr. Ramos, I think we sort of touched on this a little bit, and it's not on the page, so hopefully that's okay. We talked a little bit about language access and how that can be one mechanism into community, and that can also be a barrier, right? And that's been something this building has been incredibly focused on, in part due to Secretary Becerra's leadership. Can you talk a little bit about like cultural accommodation, cultural accessibility? Because I know like in my family, you know, I'm a loudmouth, right? Like when I go to the emergency department or appointments with my mom, I ask a lot of questions, I take a lot of notes. And sometimes, I know my aunts and uncles, my like they're uncomfortable by that, right? It's not the normal dynamic with a doctor-patient relationship. And so, you know, thinking about someone who might need health care, maybe has a language barrier, and now has to say to a doctor, no, I need this care, or yes, this is an emergency, right? Can you talk a little bit about that, Dr. Ramos, and sort of what you're seeing in California, and sort of what are some of the ways in which we can sort of alleviate that in our communities?
Sure. So the other thing that we have to realize that it's not just, you know, literacy level, right? It is culture. And we know that really the importance of when you have a provider that looks like the patient that is being served, you have more immediate rapport, follow-up, and Secretary Becerra highlighted that this morning, that his mom, you know, just started to feel more comfortable when she was being cared for by somebody that had the same language or shared the same language. So it's critically important. And so in California, one of the things that we are doing is highlighting and focusing that we need to create any program that is created with the voices, with the recommendations from the community that we are serving. So whether you're Latino, Black, Asian, whatever your ethnicity, white, we want to make sure that those voices are included in our programs. And one of those things that we're actually creating right now is a 7-question quiz that's going to help people who are maybe thinking one day I want to become pregnant, know what their medical risk would be if they became pregnant. And this is missing because oftentimes you don't realize, oh no, I'm pregnant now, and I was taking a medication that has now caused a birth defect, and the pregnancy is not viable. Now you're talking into the abortion conversation, when this person could have known beforehand, I could be at risk, maybe I want to do something else. So in California, pretty soon you're going to be hearing about PRIMA, preconception medical assessment. And it's going to be open to everybody. And we hope that that's going to be a tool and a resource so that anybody in the community can take it and know, wow, maybe I need to see a doctor right now because my health is not as risk-free as I think it is. And this is critically important because for many people of color, you don't get health care. We don't get health care until we're pregnant or we're in a situation that we want to do something about the pregnancy. It's unplanned, and which is almost half of the births in the United States. So to be able to provide the education, and I love it, to use the social media platforms, because that's where people are. You're taking in the culture, you're taking in the voices and the stories that resonate with your audience is so critically important. So I commend, my partners here on the work that they're doing, because that's exactly what we need to be doing overall.
Karen, did you want to add anything to that?
I think for us, it's just bringing that access and resource sharing. I think that we wouldn't be where we are if we didn't rely on other nonprofits or for-profit organizations that reach out to the Latino or Spanish-speaking community, because then we're all doing the same thing but separately, and if we're all get together and do it and sharing that amazing resources, then we don't have to reinvent the wheel and we can focus on something else. So I think there's power to resource sharing and to creating content. So I know now there's a lot of education around content, and I think that brings in more access to folks.
When you say content, do you mean like TikTok
TikTok?
I do, yeah, like TikTok. I've also seen like those educational, I don't have because I'm not a media person, but on Instagram, what I see a lot, it's like, oh, you want to know more about abortion? And then you slide through it, and it's like very high touch points.
Like
and
a reel.
Like a reel, yeah. And I feel like folks really gravitate towards that. I gravitate towards that too. Our Instagram page, we also have a lot of those information. So folks have those resources, because laws can be complex, right? If we didn't study law, it's so confusing. And to have it very digestible for folks, it brings more access and more power to them, because then if they do go to the doctor, they can say, oh, hey, I learned about this method of birth control. Can you tell me more, instead of going and not knowing at all what method of birth control is out there?
Yeah, I mean, so I run a civil rights office where you like anyone in this room and beyond this room can file a complaint if something you felt like you were discriminated against, you felt like your privacy was violated, you could file a complaint. But I think about that point, right? Who like it takes a very sophisticated consumer to make it to my. I think about my own family. If one of my aunts in Phoenix was discriminated against, would they know where to file a complaint? Probably not. I mean, they might know, oh, I'm going to call Melanie and ask, right? But like. No, right? And I think that's part of the problem. And so that's why we also work with a lot of community-based organizations, because they are in community, they are trusted partners, and we want to make sure things like TikTok, I think, are so immensely important, especially, I mean, even for my mom watches TikTok, right? Like and she's 75, right? So she's not like a Gen X, Gen Z, sorry, wrong generation. We're almost out of time here. So why don't we talk, just 2 quick questions at the end here. So what is one thing you think is missing from the conversation about reproductive justice, reproductive rights right now? And we'll just start with Karen and we'll go down.
I think it's still that thing of access. I think what we're seeing a lot is there's yet to have the enough access where I can say, okay, let's educate. And I think for us, one thing that we're being intentional, so I talked about our Promotoras program. We launched it during the pandemic. We launched it online, and actually we realized how accessible that was, because then it became that some of our promotoras who were moms, who were parents, were able to then access a lot of our trainings, because they didn't have to figure out logistics for childcare. They didn't have to worry about, who's going to care for the children if they do have to stay home, or if they have to drive the children somewhere else. So it gave them access, and a lot of times what they told us is that without that, they don't think that they would have continued the path with us. And then we also realized that a lot of them don't get paid what they deserve, and I made it intentional that our promotoras get paid, that if we're gonna write a grant, that their stipends are gonna be allotted into there. Because again, children can be expensive, but also things are, getting pricier. And so if we want to utilize our promotoras, we have to give them what they deserve, which is the training and the money, the funds for it. And then the last thing is just, we are now creating, I'm currently in the works to create a curriculum for sexual and reproductive health for community health workers. And we hope that when our promotoras go through this training, that they're able to build a career off of it, that is not just a volunteer group and then a volunteer program and then they leave, but they actually are able to come out with the certification, be able to then go anywhere else where they're doing repro and sexual health, and then get the payment that they deserve, the recognition that they deserve, but then that this is long-lasting, right? It's a long-lasting effect. It's not just a one-time program, but something that they can use for the rest of their lives.
So your missing from the conversation was access and education?
Yeah.
Okay.
I think what's really missing from the conversation is just the human cost of what these ideologically driven political decisions are having on regular everyday people. And the human cost is not just on the person who may be trying to seek an abortion or other reproductive health care and can't get it or has to go through so many hoops to get it, but it's also like, as we said, they may have children and there's a cost to having a mom that is even more stressed out. They have families. They may be sandwich generation, also taking care of abuela y abuelo who are happening to live with them because they're medically complex. And then the incredible cost, and I would include us, right? Those of us who do this kind of for a living, to have to be doing it day in and day out, and the emotional toll that it takes, whether you're doing it at the community level here, here in DC, or just as somebody who is trying to help out your friends and family and your neighbors. We just have to find a way to make this about our common humanity, and less about political points.
And I would probably just add to what you both said, to structural inequities, so the social determinants of health. What is it outside of healthcare, because we know that 80% of health happens outside of the healthcare setting, that we can really need to address? And some of that was mentioned was transportation, some of that is affordability, and some of that is the environmental issues that you are living in. Being able to not only access the care, but the quality care, right? So if you want to know your contraceptive choices, somebody may give you a brochure in English when you don't speak English and you don't understand, and so you think, well, okay, this is not for me, and you walked out not knowing that there was something that had someone explain to you in the language, using the verbs and the language that you understood, you would have chosen. And that could have helped that person make better health decisions for themselves. So taking into consideration the social and the structural inequalities that we all live in, it plays a critical role in healthcare decision making, because it's not just, as has been said earlier, it's not just providing coverage, it's having access, but more importantly, access to quality and culturally sensitive care that takes into consideration those structural inequities.
And I think that's great. And I want to first thank everyone in the room that works in this space, works tangential to this space. I know that you've probably heard this before, right? This is a marathon, not a sprint. You already knew that. You didn't need anyone to tell you that. So thank you so much for all the work that you do, including my colleagues here on this stage. I think it also brings importance to the fight that we're in, right? We're in a marathon. It's important to take moments to, love and take peace. And I know that sounds like super hippy-dippy, but I think it's important, right? I mean, so can we talk a little bit about what brings you joy while you're in these fights, while you're fighting for equality, while you're fighting for women, while you're thinking about education? What are the things that bring you joy? Should we start with you, Karen?
Okay. I think for me, it's this is who I am. I'm a sex educator. I remember being home, and in some spaces I just felt like it was very toxic, because it was like, oh my God, here she goes again with her political things and her like human rights, and everybody deserves this. And now it's like, oh my God, like, because we're seeing it on media, right? We're talking more about it. And now all of a sudden my family's like, oh yeah, my sister or my daughter. And 5 years ago, I felt pretty alone in this fight, right? And so what brings me joy is that this is who I am. This is who I face whenever I'm in outreach communities, because at one point I was them. My family was seeking out services. I was seeking out services. I recently changed my immigration status, and even that, navigating that was so hard. And I speak English, right? So I can't imagine folks who have that language barrier, how they have to navigate, and the fear, because that fear is so real. I was always fearful before my immigration status change of who's gonna find out and what's gonna happen, what does my future look like. So for me, being and now talking about it and having that storytelling is what brings me joy.
I want to reinforce the concept that this is really a marathon. and not a sprint. And I was just reminded that, 50 years ago, my mom was a promotora in Western Massachusetts educating people about birth control. So hopefully 50 years from now, it won't be the same, but it is very much a marathon. What brings me joy, honestly, is I have an 18-year-old son, and to see how him and his peers, and he's gender fluid and pansexual and, very, very progressive. I've had to learn a lot to parent a kid like that. And to see that his peers and his generation and how they are, the things they are thinking about and the things they feel need to be defended and the things that are fighting for just brings me there's just a level of kind of acceptance of difference and acceptance of the more varied we are, the better overall. And so that brings me a lot of joy. And just considering that I almost died bringing him here, I'm glad that it's turning out well so far. So, but yeah, seeing not just the connection and partnership across the incredible women, mostly women, some men that we work with on a daily basis, and then seeing that in the next generation, it's not only joy, but it brings me a lot of hope.
And I would say the resiliency in the Latino community brings me joy and brings me hope. Because I can't tell you how many patients, Latina patients I've taken care of now in California as California Surgeon General, seeing the struggles that many Latinos, people of color, undergo, but they still persevere. The resiliency to not only be advocates for their health, for abortion care, for reproductive justice, but more importantly, to help the comadre, to help their neighbor. Hey, I just found out about this program. Come here, come listen to this, or here. And I often told my public health colleagues when I was in LA County in public health, whatever brochure you give one Latina patient, you better believe that whole neighborhood is gonna find out what is new. So your message goes a long way. The resiliency that I see with the farm workers when I'm in the Central Valley in California, to the rural areas up in Northern California, all of that resiliency brings me hope, because no matter what, sí se puede. And it is in the Latino culture, in our blood, that yes, we may be struggling, but together, sí se puede.
And I will wrap up with my joy. So, if you've heard me speak before, you've heard me say this before. I'm a fifth-generation Arizonan. For some of you, that means something. For some of you, that doesn't mean anything. That means that my family was in Arizona long before it was a state, something I'm immensely proud of. Growing up, my mom, Arizona had a lot of racism against Mexican Americans, even though we were in the state far longer than it was a state. And so things like speaking Spanish wasn't a thing in my mom's household, because she would get hit at school. She had to sit in the basement of the downtown church because Mexicans weren't allowed to sit in the main part of the church. And I don't say that to depress you. That's our ugly history. It's real. We should talk about it, because it could happen again. It is happening again across the country, and people are trying to stoke that fear in communities across the country. But I do think that a lot of joy, my joy, comes from my mom, and I am my mother's daughter, and a generation later, I get to run a national civil rights office where I get to fight like hell for people and work with really incredible women like the women on this stage, the women that put on this event, our secretary here. So that's what brings me joy, and I hope to continue to do that work for you all. So thank you so much to our panelists. Let's give them a round of applause. 2 minutes. I'm very confused by the signage for the end of this panel. I thought I was wrapping up and over time. It looks like we have time for one more question, so I'm going to do a quick one. And sorry, you preemptively clap, but that's okay. So let's quickly just do, what is your favorite walk-up song and why? I know, totally off the wall. Go ahead.
Mark Anthony, voy a vivir, what is it? ¿Cuál es tu legado? That's vivir mi vida, something like that. Mark Anthony, always, always, always.
Okay, I have to sadly not say Mark Anthony, even though, he's Puerto Rican. It's Soy Yo de Soda Stereo. No, it's not Soda Stereo. De Bomba Stereo. I always confuse Soda Stereo y Bomba Stereo. Soy Yo de Bomba Stereo. And I've actually have used it as walk-up songs in events, just so you know.
I think for me, it's Hasta la Raíz. It just resonates so much. I forgot the artist's name. It's in my head, but the lights are... Sorry, yeah. So that would be mine.
I was going to say not something in Spanish, which makes me seem like the outlier here, so sorry. I was going to say Beyonce Girls, and I listened to that, especially the version with Maya Angelou in the middle. I probably listen to that every day since the Dobbs decision when I drive into this building. So now let's thank this incredible panel. Thank you so much for being here today. Thank you for the opportunity to share these incredible journeys with you all. Much appreciated. Thank you.
Let's give them another round of applause. Wonderful. I had a few seconds to think about my walk-in song, Director Fontes Reyner, and I think it would be Celia Cruz, La vida es un carnaval. I know that times get tough, but we have to keep on smiling. I know we're at close for the summit, or La Pachanga, as Secretary Xavier Becerra rebranded the event this morning. But before we conclude, I wanted to take the opportunity to thank Katia Mesa from my team. Many of you might know Katia and have received emails from her throughout the middle of the night. This was her brainchild. She brought us together through her labor, and so we are incredibly thankful to her for her visionary leadership and for her thoughtfulness. So thank you so much, Katia. I also just want to thank all of our panelists and attendees, both in person and virtually, who joined us for participating and for your commitment to advancing the health and the well-being of the Latino community and of all Americans. I hope that you take the insights that you learned today to your communities and to your homes. I know that we look at the work that we do beyond a profession. It is really a calling to improve and in many cases save the lives of many people across this country. And again, while our challenges are great, our fortaleza and our compassion are even greater. With that, I hope that you take everything you've gained, turn it into action, ensure that there is a healthier future. I know that we can push boundaries beyond what it is possible. Thank you, and safe travels to everyone.
Produced by the U.S. Department of Health and Human Services.